Hello and welcome to the Sharp Psych. Today, we'll get to know more about a mental illness that is called bipolar disorder. In this video, we will see the most common causes, symptoms, and treatment options to help people living with this health condition. Look at bipolar as something that moves between two poles. Imagine a ball rolling from one pole to another. When it rolls towards the right pole, it experiences extreme mania, energy, and excitement, and begins talking a lot with better focus and a high or irritable mood. This mood is marked by intense happiness, and this episode is named mania. For instance, when a person is in a manic state, he or she feels special, has extra power, and is entitled to be treated as a member of a royal family. This is called grandiosity. This experience lasts about 4 to 7 days, most likely. On the other pole, suppose the ball rolls towards the left and experiences low mood, sadness, lack of focus, and worthlessness. In short, this will be exactly the opposite of the right side of the pole experience. For instance, in this depressive state, the person feels a low mood, an urge to cry, an inability to work on daily activities, and so on. This experience probably stays equal to the time of a manic state. Now we'll head towards the cause of these episodes of bipolar disorder. But before we get started, make sure to check out the links in the description to find out more interesting facts and recommendations about psychology. And don't forget to subscribe and turn on your notifications so you never miss a video. Initially, let's compare the causes behind the onset of the disorder. Remember that there is no one exact reason that leads to the development of a disorder. There are always multiple factors that combine to develop a mental illness. The first list of causes is biological, which strongly means that it runs in families. The illnesses are more likely to pass down from generation to generation. Imagine Mr. X. He's an entrepreneur and started experiencing mood fluctuations in his early 20s. His father and aunt have been diagnosed with a mood disorder. In this way, he has increased vulnerability to meet the criteria for bipolar disorder. Any physical condition, chronic stress, sleep disturbances, and imbalance of chemicals in the brain that manages mood are other risk factors. Secondly, psychological factors are determined by problems in a person's life that are difficult to cope with. For example, imagine a girl who has been a very sensitive child. She breaks down crying as soon as she heard something troublesome. Then she also experiences moments of joy when she laughs for a long time. She might be poor at regulating her emotions. In the absence of emotional balance, the girl becomes completely distressed. Psychological factors also reveal resilience. If you find it easy to tolerate and accept unpredictable situations, you may prevent yourself from this disorder. Social and cultural factors build the third list of reasons for those functions in controlling mood-related changes. These factors include the concept of emotional expression and the extent to which they are acknowledged in a specific society's values and culture. Suppose there are two friends. One is Tina and the other is Tom. Tina cannot laugh loudly because this is considered inappropriate to laugh out loud in her culture, while Tom is not allowed to cry because he's a man. These behaviors are unacceptable in their culture, but may be recognized in other cultures. Such beliefs make it easier to label someone as having bipolar disorder. If we talk about the major symptoms of the disorder, first of all, we observe extreme fluctuations in mood and emotional changes. This is described as rapid shift in mood from pleasant to unpleasant and vice versa. The change makes it hard to interpret the present situation. People with bipolar disorder usually experience any situation based on their intensity of emotions. The people who witness changes among other people with bipolar disorder define them as unpredictable, inconsistent, and unstable. Picture a roller coaster in your mind that is not a smooth ride, but makes you pass from the paths of joy, resentment, and guilt in a short period. The changes are very obvious and at great speed. Small triggers, for example, an extra file or workload to complete, would cause this change to appear. The next symptom is the loss of concentration and fatigue or excitement. Here in this symptom, we may understand that people may either feel lethargic without any significant event at one time. At other times, the same person may look extremely energetic and excited. Take the example of Mrs. Joe, who's a home baker. She loves to bake and might bake a large number of muffins within a week. but next week she is observed as a depressive lady who cannot even stand up and start baking again. This highly affects her online business. Few weeks she bakes and sells more than her capacity, but in other weeks of the month, she cannot even complete a minimal number of orders. This causes her problems in running her business, as the customers often complain. Feeling worthless and empty or grandiosity is another symptom of bipolar disorder. People often share that they feel a sense of emptiness. They may try to withdraw from socialization while they feel worthless. For example, John is very confident at times, but a few days he behaves as if he's not good enough and doesn't deserve to be loved by his girlfriend. Other than feeling useless as a human at times, people with bipolar disorder may experience grandiosity in manic episodes. The next symptom can be seen at both poles of bipolar, like either they sense a lack of interest in previously enjoyable activities or increased talkativeness. Imagine Guy as a person with bipolar symptoms. He used to love playing golf last year. Now, he doesn't want to play golf anymore. And some days, he just says no to his friends who play with him. Other times, he calls his friends and asks them all to join in playing golf. He loves to talk and play. In those days, he just can't stop playing golf, even after a whole day of playing. The self-esteem of people with bipolar also goes through highs and lows. In a manic state, they like to focus on their qualities and strengths. On depressive days, they just feel miserable and believe they can't do anything well. The image of themselves and others fluctuates like their mood when they shift from one state to another. Before we proceed to view the common treatments of this disorder, make sure to check out the links in the description to find out more about interesting facts and recommendations about psychology. And don't forget to subscribe and turn on the notifications so you never miss a video. Now is the time to analyze the readily available, most common treatments for bipolar disorder. Number 1. Psychotherapy is a method of treatment in which a therapist provides counseling to develop an insight among patients about their illnesses. Both parties work to accept the shift of behavior as a problem and try to realize what options they have to manage their mood swings and extreme shifts of behavior. Such an illness makes it difficult for a person to function well in daily life activities. An example: a therapist and a patient usually list down the mood intensity rating out of 10 during different days of the week and different times within a day. This helps in viewing how badly mood shifts affect a particular person's life. Number 2. Support groups are designed in the form of a group of people in a therapist's office where patients who experience similar symptoms are invited to join. A therapist facilitates the group, and they share a few events that are differently experienced due to bipolar disorder. For example, a therapist gives prompts to a group of 12 people and asks them to communicate one of the best strategies that help them in calming down. One of the members may share they dig their hands in a bowl full of ice that distracts them and stops them from impulsive actions, such as an urge to jump from a high place. Another member may tell that the alternative nostril breathing is their savior. The therapist supports all the members in recalling what is their best calming down method in the absence of a therapist. Number 3. Alternative medicine is usually offered to those who find themselves tired of allopathic treatment. In allopathic treatment, a doctor can prescribe 8 pills for a patient for mood stabilization, fatigue, and impulsivity, etc., along with side effects and management. On the other hand, a prescription of herbal medicines is used by patients who love nature and believe in the power of natural ingredients for alleviating the symptoms of an illness. Lemon balm, ashwagandha, and valerian are all the names that are typically provided to relax the bipolar manic state while soothing them when in depression. Only a certified expert can guide them about their use. Number 4. Complementary therapies are famous for their treatment methods without any known side effects. An example is nutritional therapy. The benefits of food and edible ingredients for the management of behavior are very much scientifically proven in this area. Fish oil, protein-rich foods, and whole grains are some examples. Through diet that targets calming down and aims to recover a patient from losing control is provided. Certain amino acids are the builders of chemicals in the brain that controls the balance for better emotional regulation. They are namely noradrenaline, dopamine, and serotonin. And number 5, maintaining a mood diary or a journal is recommended for people who experience any shift in their behavior. Even mild changes may be noted to prevent the onset of illness, and people in severe stages can see that they need treatment as soon as possible. Few people love to read, while others love to write and draw. Find out what's suitable for you. The idea is to keep you and your loved ones safe from going unchecked and untreated for a condition that you or they might not know about. Educate yourself further about the effects of this disease. Mental health disorders are not physically seen or grown like other diseases, but it has consequences on a person's overall health and life. We hope this video has enlightened you with various new and interesting facts. Thanks for watching, and I'll see you on the next one.